My name is Dr. Kennedy Tercy, and this is Two Palms Medical Center, a specialized practice in Southern Texas focusing exclusively on gynecomastia removal surgery and men's aesthetics. In this video, we're going to be following the journey of one of our patients. He's in his early 30s, and we're going to follow him from before surgery all the way until post-op week 6. To introduce him.
Yes, I'm 32 years old. I'm about 5'7" and a half, and I weigh 181. I first noticed it right about when I was 22 when I stopped playing competitive sports and just kind of started going to the gym more often and wanted to take steps ahead and whatnot. So took some things that I shouldn't have and lived with the results for 10 years. Up until now.
And I mean, the glands that you had were quite significant. 90 grams is a good size. Yeah. Did it balloon that big like right away or?
No, it was throughout time. And at the time when I got them, I was weighing about 140. And the heaviest I've ever gotten was 195, that 50-pound range. And then I've just maintained that 180, but they were still there. I was never really a beach goer to begin with, but I would never say no if a group of friends or us wanted to go, but I would make up an excuse. Oh, I got to work. Oh, I have to study, because I knew I had to take my shirt off. So I would just avoid any of those trips. But now it might be the complete opposite. So.
Yeah. At what point did you start considering surgery?
Really considering it, been probably about 8 months. Kind of everything lined up together financially with my job and everything. And really considering 8 months. And then until I bumped into a friend of mine that recommended me here. That could not have been more than 4 months ago. So that's when I was in let's just do it.
Good morning. We're about to start our gynecomastia case for today. So our patient today is a great candidate just because he's in good shape. He has good muscle tone. Unfortunately for him, he does have gynecomastia, but on the positive end, his skin quality is so good that I think he's going to have really good skin retraction almost immediately after the surgery. In his case, we did perform liposuction as a part of his gynecomastia removal surgery, not because he's obese and not because he has any significant fat, but it helps the workflow to facilitate removing the glands in a nice, smooth, even fashion. So we started the workflow by sedating him, numbing his chest, then liquefying the fat around the glands, then suctioning out that liquefied fat and connective tissue. And then we proceeded to carefully dissect out the gynecomastia glands on both sides. So we're pretty far along on our dissection. There's only a few detachments we have to make before the gland will come out. But to give you an idea of just how big it is and how different it looks from the surrounding tissue, this here is the gynecomastia gland. And so you can see just quite how substantial that is and how this solid piece of meat is going to impact his appearance. It's sitting on top of his pec. So no matter how much he builds up his pec, he's never going to see the lower border because of this solid mass. And you can see there's still a few attachments. There's very little fat around it, but this is what a gynecomastia gland looks like. So if you go to someone and they offer just to do liposuction for your gynecomastia problem, unless your gyno is caused entirely by fat, which is pretty rarely the case, you need to get the glands removed to have the desired clinical appearance that you want. And we'll show you in just a second what this gland looks like when it's fully out. This patient had very large gynecomastia glands. On the one side, it was 90 grams. On the other side, it was about 60 grams. And I want to show you these things for educational purposes, but if I do, this video may become age restricted and may not reach the amount of people that we'd like to reach. So in the future, what I'll be doing is I'll be creating a free Patreon. So if you're interested in seeing what the gynecomastia glands actually look like and seeing the actual surgery that we're doing, you know, it's a little bit too gory for a lot of people. Some people want to see it, some people don't. If you're interested, note that we're going to be setting that up in the future and it's going to be free. It's just so that we don't get restricted on YouTube and other platforms. This is our patient immediately after surgery. You could see us removing the ACE wraps, compression garments, bandages. And here we are removing the drains. During his recovery process, we were able to get footage of us evacuating some of the seromas he developed over time. You could see in this video the fluid coming out during the needle aspiration. One thing to note is the color of that fluid. It is red. Most people become concerned that it's blood, when really it's inflammatory fluid tinged with a little bit of blood. If it were just frank blood, then it would coagulate or congeal and it wouldn't come out with that syringe. But the fact that that fluid is so runny and comes out through the needle is a sign that it's just a seroma, which is not a big deal. It's very common after gynecomastia surgery. We evacuated it for him a couple times because he's local. For our out-of-town patients, we send them the supplies to do it themselves, and it's not a problem. For guys that are wondering about surgery, thinking where they're going to be a week after surgery, a week and a half after, what can they expect?
Little to no pain, honestly. If you do have, I guess, any pain, if you want to call it, it'll probably be from the bandages. That's about it. But other than that, you will have no pain whatsoever, even during sleeping at night. Just, sleep regular, but no pain whatsoever, and that's not even exaggerating. Overall, it was very, very good process. Happy with the results. So main thing is that first week, follow instructions to keep up with your antibiotics and all that. That really helped out a lot too. The pain medication, just in case you do have any of it, but like I said, I experienced zero pain. So
in his case, the only thing we're really mindful of at the moment is on his right areola, kind of at that 6 o'clock position. There's an area that's a little bit darker that we're keeping an eye on. My concern is that maybe there's a little bit of decreased blood flow to the superficial layer of skin, and maybe the blood flow is compromised and it's causing the skin to slough off. At this point, I don't recommend any aggressive interventions. Really, the only things I could think of that might be helpful would be like hyperbaric oxygen, but I think that might be overkill for what we're seeing now. It may slough off, scab, and heal, and because that whole process is a pretty lengthy process, taking the course of months, it may be a good while before that area starts to match and color the rest of the areola, but even if there is a slight difference, I don't think it's really that meaningful in the grand scheme of the overall results. But there's really areas that we're really looking at. I removed some stitches on both sides. We'll keep an eye on those areas and how they heal as well. His skin is very reactive to the adhesive from the bandages, so we can see the marks clearly, which is impacting the aesthetic of the result, but he'll get to stop wearing them pretty soon. And I'm going to see him in 1 week, and that is it for post-op day 10. And this is our patient 3 weeks after surgery. You can see he's healing very, very well. There's almost no signs that he had surgery at all. He has a little bit of dark spots on the areola, which is maybe a little bit of ischemia, but it looks like it turned the corner and it's gonna heal up just fine. A small commentary about his case is his sensitive skin. If you'll notice, he has bandage marks around both areolas. This doesn't happen all that common, but it does happen. And it depends on the different chemicals used in the bandage adhesives between the different manufacturers. For patients of mine that do develop some irritation, I recommend they stop using that particular bandage type and switching to an alternative. So if they're using a CVS brand, maybe try switching to a Walgreens brand and see whether or not that decreases the body's reaction to that. For him, it has subsided over time, but it's one commentary I want to make if you notice the appearance around his areolas. We just evacuated about 8 milliliters of fluid on the right, 3 milliliters of fluid on the left. It's very minimal amounts, but bruising is minimal. You could already see the contour. The skin is hugging his lower pec, where before there was that big mass kind of adding volume to the lower chest, which is now completely gone. His recovery has gone about as good as you could hope for. And I'm happy, hopefully he's happy. And life is good. Here is our patient at post-op week 6, and he looks great. I'm very happy with the way things turned out. When the results look this good at this point, it's a sign that they're gonna look even better at month 6, month 12, and a year and a half, because that's how long it takes for the swelling and inflammation to fully subside. If you have gynecomastia and you'd like to learn more, then follow our channels. We'll be posting more educational content in the future. If you're ready for surgery, then contact us. You could use the link below to schedule a free phone consultation with yours truly. Gynecomastia is a treatable problem, and we're here to help.